My name is Dr. Robbie Crouch. I'm a family medicine doctor. I work out of Driggs, Idaho, in rural eastern Idaho. I was trained in rural family medicine with a fellowship in obstetrics. I grew up with my father practicing OB and seeing the joy that it brought him. My oldest brother also became an OBGYN. I've got one brother who's a pain medicine doctor, one brother who is a PhD in epidemiology. So medicine is pretty strong in our family. Obviously, a lot of us were very inspired by him as a physician. He loved his job. He was always working and loved every minute of it. He was called away from our recitals and school activities to go deliver babies. And seeing how much joy that brought him really helped us, I think, understand the joy that can happen with obstetrics. That joy was really muted by the uncertainty of early pregnancy care. In 2022, there was what was called a trigger law in Idaho that went into effect where all abortion care in the state of Idaho was significantly and severely limited, essentially making it illegal to perform any type of abortion in Idaho for any reason. There was a lot of uncertainty, a lot of sadness, and a lot of, frankly, panic in the medical community. We no longer knew how to care for patients. We would have had to wait until the mother was potentially septic or in shock or hemorrhaging greatly before we could do anything. Was the rule that we had to just wait it out until the mother was about ready to die before we could save her life? The uncertainty made it so that it was unsafe for them to practice here in our state. And some of them left the state because of it. At one point, we're down to less than 10 high-risk doctors for the entire state of Idaho. The wait times get longer, the distance people have to travel get longer. The availability of high-level care diminishes greatly. There were a lot of reasons why I stepped away from obstetrics. That was definitely a factor, and it definitely made it easier for me to walk away. Abortion is a complex medical issue. It can be anything from a genetic defect that will not allow for a viable pregnancy, an unknown medical complication that the mother had that wasn't diagnosed until after pregnancy, where the pregnancy can put the mother at risk. There's 1,000 different things that can happen. What I wish people would understand is that those decisions are not taken lightly. Each person is really considering what is best for them and their family and their health and the health of their child. This is a challenging law for Idaho. It's based in something that is so meaningful to so many people. It doesn't allow for decisions to be made on the personal level. The physician has the training to understand what is risky, what is safe, what is potentially harmful to a mother, and the mother has the ability to understand what's best for her family and for herself. The law complicates that, and it gets in the way of what should be a very personal and very thoughtful decision between a woman and her care team.